So I'll be presenting a little bit today before actually handing over to Q, who is our senior product manager at Limbic and is primarily responsible for our Limbic Care product, which is perhaps a bit newer to people on this call. But yeah, Q, if you were happy to share the slides, I'll just give a brief introduction as to what Limbic is. So Limbic is essentially a clinical AI company. We use and leverage our own proprietary clinical AI to increase access to mental health support, improving patient engagement, and enhancing treatment outcomes. All whilst kind of helping and empowering the clinicians who are, on the ground and delivering that kind of highest standard of care as possible. So, we're very clear that we're not here to replace clinicians. Can AI ever replace the incredible work that clinicians do on the ground in front of patients? That's not what we're here to challenge at all. But we do want to help and support increasing access, engagement, and outcomes. We do that primarily through two solutions that we have, Limbic Access, which is our referral and assessment assistant that kind of streamlines intake and that referral process, and Limbic Care, which is our engagement and kind of treatment support app that helps patients stay connected between sessions and improves kind of reliable recovery rates. And I guess just to kind of iterate, our goal, our vision as a company is really to increase the capacity and effectiveness of the clinicians within the services that we work with. Um, and I think we're going to mainly focus on limbic care today, but just to give a brief overview in case people haven't heard of limbic access, Q, if you wouldn't mind skipping a couple of slides there. Um, so Limbic Access is probably the reason why you may have heard of Limbic. It's an older product of ours. It initially launched in 2021. And through our time working with NHS Talking Therapies, we've helped over 500,000 patients access talking therapy support. We're kind of working with more than 40% of NHS talking therapy providers currently. But as I said, today we're going to focus on our Limbic Care product and introduce some new improvements, but also a few new features that have been kind of developed in the last 6 months or so, working with a few of our clients and services who are already using the product. And it's really focused on improving the clinician experience as well as offering additional functionality to patients to improve those all important reliable recovery rates. So I'll keep quiet now until the Q&A, but I'll hand over Q to take you through our Limbic Care product offering.
Perfect. Thanks, Kathleen. So I'll dive in a little bit deeper into limbic care as Kathleen has kind of teased. But basically, limbic care is composed of three core components that are all integrated into a single clinician dashboard. So first on the left here, we see our patient app, which provides between session patient support using evidence-based CBT activities. In the middle, we have that clinician dashboard, really serving to provide visibility into what patients are actually doing between sessions via that patient app. And then the third on the right here, a beta feature that we're very excited to introduce, which is an ambient voice technology or AI scribe that's embedded directly into the Limbic Care dashboard. So these three components all together are really designed to reinforce each other inside that one single clinician workflow. So limbic care has also been evaluated in real world settings. So we have a lot of peer reviewed evidence that you can always find on our website as well for more detail. But we've seen a lot of great improvements in recovery, reduced dropouts, as well as higher session attendance. So again, as Kathleen mentioned, those gains don't come from replacing therapy. They really come from supporting patients between sessions and helping our clinicians use their time more effectively. So if you've heard of limbic, you might have also heard of the limbic layer. So at Limbic, we really believe that safety is a number one priority, especially with the use of AI in a clinical setting. So under the hood, what that means is that Limbic uses a large language model or LLM, but it's wrapped in what we call the Limbic layer, which is a proprietary model that has been specially trained to provide the ultimate kind of safeguards for patients, making sure that what the patients are seeing is both clinically accurate and safe for them. So this is really what allows us at Limbic to be that trusted partner with those NHS talk therapy services. So diving a little bit deeper into each of those three core components that I introduced, this is the patient-facing side of Limbic Care. So it's really how we deliver that configurable, evidence-based CBT to patients in a way that, again, is safe and engaging. So this is something that we partner with talk therapy services to co-develop the content that's delivered, but in a way that's very interactive for patients in this chat type model. So clinicians can also highlight specific content for individual patients in a way that they're able to tailor the content to the specific needs of that patient rather than a one-size-fits-all model. From a clinician's perspective, everything really lives in one single place on that dashboard that I mentioned. So things like patient activity, summaries, and now AI scribing functionality are all available in that kind of one-stop shop or that patient hub. And so for clinicians, it really means that they have clear visibility into what patients are working on between sessions and really allowing them to have better continuity when the patient does come back into therapy. So, diving into our new AI scribe capability, really what we're looking at is giving clinicians the ability to record and transcribe therapy sessions in a clinically trusted and safe way directly inside of Limbic Care. So I know there's been a lot of talk about increasing capacity, but what we're looking to do really is both increase the amount of time that that clinicians are able to spend with patients, but also really reducing the cognitive load and admin time for clinicians so that they can really spend more time providing care in person or virtually with patients. So because it's embedded in Limbic, it's really nicely fit into how clinicians already work in that one single stop shop. So what's next for Limbic? We're always looking to improve. So our focus is really on improving both patient outcomes and making clinicians' day-to-day experience both easier and more effective. And so you can see that with our near-term roadmap. So we have in January, we're releasing some usability improvements to our dashboard, making the workflow for clinicians a little bit more intuitive, a little bit easier, something that we're always looking to improve. As well, in the middle here in February, you can see we will be releasing a new feature called guided sessions. So these are going to be short, structured, clinically designed mini sessions in the patient app. And they're really meant to be used between appointments or when patients are waiting to start therapy, really looking to engage patients more rather than having them lose momentum. So, we're always looking to invest in things that genuinely move the needle for patients and their outcomes. And finally, here in March, as I've kind of mentioned already, we have our new AI scribe functionality that we're very excited about. So in that spirit, we're always building Limbic in partnership with services and would love to hear your thoughts. So I'll just kind of end off our presentation with a question to the group, and I'd love to hear the responses in the chat if you don't mind. But what problems do you want Limbic to solve next? I'd love for you to consider what would help you feel more fulfilled and effective in your practice, something that you would love for us to kind of think more about moving forward.